children with Down syndrome are affected from birth. You may see as children get older some developmental delays, including some difficulty learning, sometimes trouble in school, and sometimes other developmental delays such as physical delays or speech delays, things to that effect.
To try to give you a perspective of what it's like to talk if you have the same anomalies and the same physical makeup as a child with Down syndrome or an individual with Down syndrome, is that you think about when you've had a swollen mouth or a swollen tooth or something that's really got you filled up in here, and also when you even have a sore throat, because oftentimes they have enlarged adenoids, which tends to push them even further, their tongue even further out. So it's almost like they have a mouthful to deal with, and they're trying to speak normally. They're doing their very best to make themselves understood.
There are some very characteristic features that we identify as early as the newborn nursery that may show us that that baby could have Down syndrome. Sometimes babies with Down syndrome may have ears that are lower set on the head. Sometimes their eyes may look different. They may have shorter fingers, and sometimes the webbing on their hands is a little bit different compared to other babies who were born.
These children have delays in fine motor skills. A therapist could start seeing a child with Down syndrome at 6 months old to begin helping them with manipulation of objects, holding an object, working on core strength and balance.
If you've not met anyone with Down syndrome and you're going to meet someone with Down syndrome, you're in for a treat.
Most of my patients with Down syndrome are very happy, and in fact they come in, they light up our office while they're here.
I would have to tell you, if you have never met a child with Down syndrome or an adult with Down syndrome, go and volunteer. They teach me as much as I hope I teach them in a day.
Although children with Down syndrome may have very similar facial features and physical characteristics, they are certainly individuals. And you may see one child who is very gifted athletically, and you may see another child who's very talented in the arts, maybe an artist. So it's important to understand that although a child with Down syndrome may look like another child with Down syndrome, they have their own personality and their own personal attributes that are very special.
Make sure when you see a child, an adult with Down syndrome who is working at a restaurant, who's sitting next to you in that classroom, that you tell them they're doing a good job, because they have worked so hard to be where they're at.
They're all different. Don't think they're all alike. They're all different. They all have their own personalities. They all have their own goals and dreams, likes and dislikes. So therefore they're like the rest of the world.